Calcium plays a crucial role in maintaining the health of our bones and teeth, but its significance extends beyond just skeletal strength. It is essential for various bodily functions, including muscle contraction, blood clotting, and nerve transmission. About 99% of our body's calcium is stored in bones and teeth, acting as a reservoir for maintaining normal blood calcium levels. So when there's less calcium available for other bodily functions, our body tends to metabolize and extract calcium from our bones to meet immediate needs. This process, known as bone resorption, is mainly regulated by the parathyroid hormone. It can happen due to many reasons, such as chronic low calcium intake, vitamin D deficiency, hormonal imbalances, and certain foods that trigger our body to pull calcium from our bones. So, in this episode, let's learn about 7 foods that might be pulling calcium from your bones, degrading bones, and disturbing your body's functions. Let's begin. Number 1. Sugar. When you consume sugary treats, your blood sugar levels spike. To counteract this, our body releases insulin to bring those sugar levels back down. When insulin levels are raised, it signals the kidneys to increase the excretion of both sugar and calcium through urine. As a result, more calcium is lost in the urine, and the body tries to compensate for this calcium loss by pulling it from the bones. This process, known as bone resorption, weakens the bones over time and can contribute to conditions like osteoporosis. According to studies, for every 100 grams of sugar consumed, about 6 milligrams of calcium is lost through urine. Considering that an average American consumes foods with added sugars around 17 teaspoons per day, which is more than double the recommended limit, you can see how this calcium draining cycle becomes a real concern. To put it simply, excessive sugar not only causes weight gain, but also messes with your bone density. It's another reason to keep an eye on your sugar intake and opt for a balanced diet that supports both your sweet tooth and your bone health. Number 2. Caffeine. Caffeine, usually found in coffee, tea, energy drinks, and some sodas, can interfere with calcium absorption in the body. When you consume those drinks, it increases the amount of calcium excreted through urine. This is mainly because caffeine can promote the release of parathyroid hormone, which regulates calcium balance. Increased parathyroid hormone levels signal the bones to release calcium into the bloodstream. While this might be a short-term fix for maintaining blood calcium levels, over time it can contribute to bone loss and weaken bone density. Now, if you're a caffeine addict, it doesn't mean you have to cut off your favorite tea or coffee entirely. Just ensure you're getting enough calcium in your diet through sources like dairy products, leafy greens, and fortified foods to counterbalance the calcium loss caused by excessive caffeine consumption. Number 3. Excessive protein. Our body strives to maintain a delicate pH balance within a specific range, around 7.35 to 7.45 for optimal functioning. But when we consume protein, our body breaks it down into amino acids. During this process, our metabolism generates acidic byproducts like sulfuric and phosphoric acids. One of the ways our body neutralizes these acids is by using calcium. Calcium acts as a natural alkaline mineral, binding to the acidic compounds and forming soluble salts that can be excreted through urine. This process, known as calciuresis, helps maintain the desired pH balance. According to studies, high protein intake, especially from animal sources, might be linked to increased calcium loss. Studies show that for every 1 gram increase in protein intake, there's a 1.75 milligram increase in urinary calcium excretion. Now, that might not sound like much, but over time, it can add up and affect your bone health. Now, you don't have to stop your protein intake, it's just about finding the right balance. Men need around 56 grams of protein per day, and women need around 46 grams. So make sure to watch what you eat and how much quantity you consume. Number 4. Vitamin A. Vitamin A is crucial for various bodily functions, including vision, immune system support, and skin health. But too much of it, especially in the form of retinol found in animal sources, may interfere with calcium metabolism. Retinol stimulates a type of cell called osteoclasts, which are responsible for breaking down bone tissue. While some level of osteoclast activity is necessary for healthy bone remodeling, High vitamin A can overstimulate this activity, causing bone degradation. The tricky part is that vitamin A toxicity is possible, particularly through supplements. In fact, studies show that women who took too many vitamin A supplements had more than 2 times higher risk of developing wrist fractures. Getting enough vitamin A from a balanced diet is generally safe and recommended by most experts. Number 5. Foods high in salt. The more salt you consume, the more calcium your body may lose through urine. Processed and packaged foods, such as canned soups, salty snacks, and processed meats, seem to have become a significant part of our daily diet. The American Heart Association recommends a daily sodium intake of no more than 2,300 milligrams, with an ideal limit of 1,500 milligrams for most adults. Shockingly, the average American diet often exceeds these limits, with estimates suggesting an average daily intake of around 3,400 milligrams. So high sodium or salt intake cannot just cause high blood pressure, heart disease, and kidney problems, it can take a toll on your bone health too. Number 6. Alcohol. First off, excessive alcohol intake can directly interfere with our intestines' ability to absorb calcium. Plus, according to a 2018 study, alcohol also stimulates and impairs the activity of osteoclasts, the cells responsible for breaking down bone tissue. Studies show that excessive alcohol consumption is linked to a higher risk of fractures and osteoporosis, a condition characterized by weakened and porous bones. In fact, according to a 2013 study, women consuming more than 20 grams of alcohol per day, which is around 2 standard drinks, had 3.5% lower bone mineral density in hips and 5.7% lower BMD in the spine compared to those with no alcohol intake. One 2017 study shows that an additional 10 grams of alcohol intake per day was associated with a 14% increase in the risk of hip fracture in men and a 16% increase in women. Number 7. Foods high in oxalic acid. Spinach, beet greens, rhubarb. These nutritious vegetables contain oxalic acid, a compound that can interfere with calcium absorption in your gut. Oxalic acid binds to calcium in your food, forming insoluble crystals that your body cannot absorb. This can lead to a decrease in calcium availability in your bloodstream. When this happens, your body may turn to its bone reserves to maintain blood calcium levels, potentially impacting bone density over time. It's important to note that moderate amounts of oxalic acid are generally not a concern for healthy individuals. However, if you have a history of kidney stones, calcium deficiency, or other relevant health conditions, you may need to be more mindful of your oxalate intake. The science confirms the potential downside. For example, a study published in the American Journal of Clinical Nutrition found that women with high oxalate intake, over 300 milligrams per day, had 6% lower bone density compared to those with lower intakes, so it's crucial to maintain a balance between calcium intake and foods that contain oxalic acid. If you have any concerns about your calcium intake or bone health, consulting your doctor or a registered dietitian is always recommended. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.